Hi. Most people think of the Core-Tex as primarily a lower extremity device or a device for core strengthening, athletic performance enhancement, things like that, which is all true, but I found some ways that are unique to the Core-Tex that I can utilize for my shoulder patients. We take the Core-Tex and we get it off the ground, we put it on a treatment table, and then we take it from there. As you can see, even up here, the Core-Tex has to move in all three planes of motion, and we have to react to all three planes of motion. So when I'm starting off with a shoulder patient who's in pain, whether it's post-op or needs capsulitis, anything I want to try to regain some mobility in the upper extremity, is a nice way to start that. Typically, therapists call that wax on, wax off. We can do the same thing here with the Core-Tex. We have the patient put their hand on one side, and then they rotate it around, and they like that closed chain feeling of having their hand on something because it forces your body to react to that compression a little bit, which stimulates co-contraction of your shoulder stabilizers. The other nice thing that it does is it provides scapular mobility. The scapula is going to have to, again, move with your arm. So you're getting some extrusion, you come back closer, you're getting some retraction. And actually, you can cue the patient to do those motions at the same time. You can say, now that you bring back, please retract your scapula. As you move forward, let your scapula round out. You're getting that nice back and forth motion, a very nice first step. You know, the next place I would take them would be to facilitate internal and external rotation. So you can put their hand on the treatment table, the opposite hand for system stability, and you make sure the elbow is over the center of the Core-Tex so that the center of rotation is close to the center of rotation of the Core-Tex. Again, just putting their weight on here, and they're having to react a little bit to all three directions of motion. And you can facilitate all of those motions and the body's reaction to those motions. And you can do sagittal plane, you can do frontal plane, and then you can do internal rotation and external rotation. You can also start very simply with short amplitudes, and then you can increase the bigger amplitude as your patient can tolerate it. So to progress this position, we can start it here standing, and then if you happen to have a high-low table, which most people do in their clinics, you can lower this down, and this will allow your body to get up over it a little bit more. Another thing we like to use the Core-Tex for is for gaining some end-range flexion for our advanced patients. We're trying to gain that last bit of flexion and abduction. Sometimes, you know, that's the hardest thing to get back, and sometimes it's that one key element to make sure that they're pain-free. So what we can do is we can get back into an backed away from the table. We get into the full flexion position, and you can do this with the palm down or the palm up. The palm down or thumb up. The thumb up position is probably more comfortable for most of your patients, but just experiment with that a little bit. So you bring them into the terminal range, and you can do short little motions that provide that end range stretch. And again, even though this looks like it's only in one plane of motion, I have to react to all the different planes of motion and the reaction that the Core-Tex is providing. You can also add frontal plane motions by moving the arm side to side during that position. You can also add some transitory motion, and let me show you those now. This is just a small sample of the things that we can utilize the Core-Tex for in our clinic. These are some upper extremity things we've shown you. Again, your imagination is your only limitation. We've been able to come up with a few little samples today, but I'm sure that with your ingenuity, you can come up with lots of things yourselves. Hope you enjoy it.